This is Robin. The robin. He lives in a tree with his family. One day, Robin started to feel very hot and sweaty. He'd caught an infection from one of the other birds. Much to Robin's parents' surprise, his feathers on his tummy started going red. The hotter he was, the more of his feathers turned red. Robin has developed a fever. The best way to find out if your child has a temperature is with an underarm thermometer, or an in-ear thermometer if your child is older than 1 year. These readings are more accurate than from forehead thermometers. A fever in a child is any reading of 38 degrees Celsius or 100 degrees Fahrenheit or higher. Fevers are really common in children, and the vast majority of fevers are caused by viral infections. These will normally go away by themselves, and they do not respond to antibiotics. They just need to be well supported at home. If your child has a runny nose, red eyes, flu-like symptoms, or diarrhea and vomiting for a few days, it's most likely that they have a viral infection. These are also spread easily, so if someone else in the house is also unwell, it's common they both have a viral illness. The most important thing with fevers is knowing when it's not okay to wait at home. So, when should Robin come to the hospital with a fever? The following are the red flags or most worrying signs when you need to come to the hospital or call 999. If your child is under 3 months of age and has a fever over 38 degrees Celsius, you should come to the emergency department. In babies and children of all ages, you should come to the emergency department if they are cold to touch or appear pale and mottled, they have blue lips, or they have pauses in their breathing lasting more than 10 seconds. They are breathing very fast and hard, too hard to talk or eat and drink. They have a fit or seizure, or make abnormal movements of their arms, legs, or face. They become very lethargic or drowsy, so you struggle to wake them up, or so irritable that you cannot calm them. Or they have a rash which does not go away when you press it or use the glass test. These may be symptoms of a severe bacterial infection, or in the worst case, what we call sepsis. Robin doesn't have any of these symptoms, but his fever is still really high, even after taking paracetamol. This doesn't mean his infection has gotten worse, or that he should come to the hospital. It doesn't matter how high a child's temperature is as long as they're over 6 months old. They can have a really high temperature with a mild viral infection, or a slight fever with a severe infection. The main thing is how well or unwell the child is otherwise. This will include how the child is behaving when they don't have a fever. If they feel better when the fever subsides and are able to play and to eat, this is often a reassuring sign. You should go to the GP or call 111 if your child is showing any of the following amber signs. Breathing faster than usual or finding it hard to breathe, especially when the fever comes down, as children generally breathe fast when they have a fever. If they seem dehydrated with less than 3 wet nappies or wheeze in 24 hours, with dry mouth, sunken eyes, or they have become a bit drowsy. If they are more drowsy than usual, excessively sleepy, or very irritable and you cannot calm them down, particularly if persisting when the fever settles. If they have extreme shivering or pains in their limbs. If they have a red, hot or swollen joint, such as their hips, knees, ankles, or elbows. If one eye appears swollen and red. If they have severe pain, particularly in their tummy, which does not get better with painkillers. If they are aged 3 to 6 months old and have a fever of 39 degrees or above. If they have a fever lasting more than 5 days and it is not getting better. Or if they are getting worse and you have other concerns about them looking unwell. Robin doesn't have any of these symptoms either. So, what should he do? Robin should be able to have his symptoms managed at home. Here are some things that might make him feel better. You can help your child feel better by giving paracetamol, Calpol, if they have a temperature or if they are in pain. You can give 4 doses in a 24-hour period, but there must be at least 4 hours between each dose. You can also give ibuprofen or Nurofen, but sometimes ibuprofen on an empty stomach can cause your tummy some irritation. You can take these at the same time or alternate them throughout the day. When you have a fever, you sweat more than usual, so you need to keep well hydrated. Apple juice diluted with half water is perfect if they are over 6 months, and if they are under 6 months, then offer their usual breast or formula feed more frequently. You can also consider oral rehydration solution, for example, Dioralyte, as extra fluid. Take off a layer of clothing if your child has a high fever, although do not put them near cold windows as this might make them shiver more. Do not use a wet sponge, this may make your child shiver and will make them more uncomfortable. Some people worry about fever fits, also called febrile convulsions, which is when your child may have a fit when they have a high temperature. These may happen between the ages of 6 months and 3 years, when a child's temperature rises very quickly, normally on the first day of an illness, and it causes them to have a seizure. These are really scary to see, but are very common and happen to 1 in 20 children. That's at least 1 child in every class at nursery or school. They normally happen with viral illnesses, and if they happen, you should turn your child onto their left-hand side in case they vomit and call 999 immediately. There is nothing you can do to stop a fever fit from happening, even if you have given the maximum paracetamol or ibuprofen allowed in a day. Remember, you can also always speak to your pharmacist, health visitor, or school nurse if you need advice when it's not an emergency. You can download the handy app to your phone or search for the Healthier Together website online. They're great at helping you know when to access healthcare and what you can do at home to feel better. Thank you for watching.